Today we're going to discuss a matter that is urgent. It is providing additional funding to the VA, to the Veteran Benefits Administration, so it can deliver benefit payments to its veterans and their families on time. So the question is, how do we get to this point? Simply put, VA is providing more disability benefits to more veterans than ever before. From my perspective, that's a part of living up to the promises of war. It's a good thing. I'm aware of the letters from my colleagues that are blasting the VA for moving too quickly to provide benefits under the PACT Act. But the message I've heard from the veterans in my treasure state of Montana and across the country has been very clear. These folks have approached us at events in our states. They've written letters and emails, and they've gone out of their way to express gratitude to Congress and the VA, and to let us know these benefits are having life-saving effects. Many of them, particularly the Vietnam-era veterans, waited decades for these benefits. It is shocking to me that some are now telling them that they should have to wait longer because the price tag was too steep. Look, we knew addressing long-ignored issues like toxic exposure is going to cost a few bucks, but it is the right thing to do. Over the past 2 years, VA has approved nearly 1.2 million PACT Act claims, and more than 335,000 veterans have enrolled in VA healthcare thanks to the PACT Act. Like I've always said, if people up here have a problem addressing the true costs of war, they shouldn't send these folks to war to begin with. Today, I'm hopeful the Senate is finally going to act on this supplemental funding. It is not the time for partisan politics, as typically has not been the case on this committee, or for misleading rhetoric about a manufactured crisis. It is time to act to ensure that 7 million veterans and their families aren't left wondering whether they'll receive their benefit checks in the next 13 days, because it runs out September 20th. With that said, we need to have a serious conversation about how the VA can better account for emerging trends in its budget, potential disruptions of care, or benefits are in no one's interest. And I have a lot of questions about the FY25 shortfall within the Veteran Health Administration, particularly about what is driving these unexpected costs. And as we look toward providing sufficient longer-term funding for the department, I'm working in a bipartisan, bicameral way to ensure that we're requiring more transparency in reporting from the VA on budget projections and execution. As we head down the road, I hope the colleagues on this committee will work constructively, as always have, to ensure the department has the resources it needs to take care of those who have borne the battle. That is, after all, why this committee exists. With that, Senator Moran, I will turn it over to you.
Chairman Tester, thank you. Thank you for, I asked for this hearing. Thank you for agreeing to that request. And I would expect my colleagues and probably your colleagues to join us.
Yeah, they will.
I don't know that I need to have a conversation about providing benefits. We're for that. When veterans are entitled to benefits, we want them to receive them. But here's what troubles me is the lack of budgeting accountability, knowing the facts in time to make better decisions. And what is really troublesome to me is the lateness in which this issue arose. And I'll explore in my questions with the two of you the nature of what transpired that led us, in my view, for Congress to be unaware. And the reality is that whatever the reason for the need for additional authority, we were not told. We were not told until after the Appropriations Subcommittee marked up its bill. In fact, we were told the next day. And we were not told when, by OMB, that this was coming. And that occurred, but no reason to tell us, I suppose, is my theory, when we're trying to figure out the allocation between domestic spending and defense spending. So my complaint today is really with the level of trust and respect that I would hope we have from the Department of Veterans Affairs. I know the leadership and many people who work there. You all do a really good job of communicating with me on an ongoing basis. But if you do that on things unlike this significant shortfall, I'm troubled why wouldn't you call and inform us about the problems that are arising so that we can make the decisions at the appropriate time and avoid this, I mean, this is important. What happens today and tomorrow on this issue in the Senate matters, and whether veterans and their families receive benefits on time. And Congress could have handled this in a different way, but it seems to me the VA and the OMB, they failed to just pay the respects to the United States Senate and to members of the United States Senate in this committee that they know. And so my complaint is the nature of lack of notice and knowledge. And it seems to me, I hate it when newspaper editors put motives behind my actions. They don't know what really went on, and maybe I'll learn, but it seems to me the motives were to have Congress make decisions before we had the facts. That's wrong, and I expected something different from the people I know and work with at the Department of Veterans Affairs. Thank you.
Well, hopefully you'll be able to you'll be able to address some of those questions in your opening statements, if not all of them. I want to thank the witnesses for being here today. It's not the first time that Dr. Elnahal and Josh Jacobs has been in front of this committee. Dr. Elnahal is the Undersecretary for Health. Josh Jacobs is the Undersecretary for Benefits at the Department of Veterans Affairs. You will each get 5 minutes. Know that your entire written statement will be a part of the record. And with that, Dr. Elnahal, you get to start.
Thank you, Mr. Chairman, Mr. Ranking Member, and members of the committee. At VA, we are on a mission to provide more care to more veterans than ever before. And since the historic expansion of benefits under the PACT Act, our commitment has been to enroll as many veterans as we can into VA care because we know it is the best and most affordable care for veterans. On March 5th, we made new groups of veterans eligible for VA health care years earlier than required by the law, including every veteran deployed to a post-9/11 mission, regardless of their condition or service connection. Any toxic exposed veteran exposed at home or abroad now also qualifies for direct enrollment. We've held thousands of outreach events across the country over 2 years to meet veterans where they are. At our Vet Fest event this year in Fayetteville, North Carolina, we met Vietnam veteran Danny Cox. Years ago, Danny's service did not qualify him for VA healthcare, and he didn't have high expectations. So he was, quote, over the moon to learn that thanks to the PACT Act, he was now eligible to enroll. He tells us that not only does he appreciate that his healthcare team knows veterans, but that this will help his family also financially. He now tells every veteran he knows to get care at the VA. We've enrolled veterans like Danny at historic levels. Since President Biden signed the PACT Act, 740,000 veterans have enrolled in VA healthcare, 33% more than the equivalent period prior to the PACT Act. Further, 900,000 veterans saw their priority group increased, reducing their out-of-pocket costs and in many cases allowing them more care options like long-term care and dental care. We're also delivering more appointments to veterans than ever before. We're on track to exceed last year's record and deliver over 130 million appointments this fiscal year between our direct care system and the community. And we're exceeding previous records in pharmacy and prosthetics with 5% more prescriptions and 10% more prosthetics delivered this year than last. To prepare for this record-breaking delivery of much-needed care to veterans, we embarked on a historic hiring effort in 2023. Despite industry-wide headwinds in recruitment and retention, last year our workforce grew at rates not seen in 15 years. That includes increases in critical occupations, most notably physicians, nurses, medical support assistants, food service workers, housekeeping aides, and more. Hiring more than 60,000 healthcare workers was the right decision to ensure that we had the capacity to meet the needs of veterans. We also placed an emphasis on improving clinical productivity, holding a series of what we called access sprints earlier this year. Over just a couple of months, our teams across the nation made it easier and faster for veterans to access VA care by offering night and weekend clinics, by increasing the number of veterans scheduled into daily clinics, and more. We continue to see the impact today with wait times in a direct care system down for both primary care and mental health new patient appointments. Further, we're leveraging every modality of care to open VA's doors wider for veterans. Since the start of the pandemic, we've seen telehealth episodes triple, utilization of clinical resource hubs, home-based primary care, and e-consults all show rapid increases even just over last year. And I'm happy to report now that all of our VISNs have access to tele-emergency care services for veterans. Across all of our efforts, we prioritize veteran feedback about their care and, of course, care quality and outcomes. Earlier this month, we were proud to announce that VA hospitals outperformed non-VA in CMS's star ratings for quality and patient safety for the second year in a row, and for patient satisfaction for the 9th consecutive quarter in a row. Most importantly, we continue to see improvements in veteran trust, which reached an all-time high of 92%, of veterans telling us that they trust us for their outpatient care. As we've communicated throughout the year, we continue to exceed even the most aggressive expectations for care growth delivered this year. That's growth in services to veterans, along with factors such as rising costs for pharmaceuticals and prosthetics, and continued year-over-year growth in the need for community care referrals, which has resulted in the need in totality for additional funds. We've requested an anomaly of $12 billion for the potential medical care shortfall going into FY25. Without these resources, VA will be forced to make difficult cuts, most notably to outreach, care coordination, and more. This funding is necessary to continue to deliver more care to veterans than ever before and maintain our achievements in quality, access, and all-time high veteran trust. Chairman Tester, Ranking Member Moran, members of the committee, thank you again for the opportunity to appear before you today.
Thank you, Dr. Elnahal. Josh Jacobs, you're up.
Good afternoon, Chairman Tester, Ranking Member Moran, and members of the committee. Thank you for the opportunity to appear before you today. As you know, VA is currently delivering more benefits to more veterans and survivors than ever before, which is largely a result of the historic Sergeant First Class Heath Robinson PACT Act, as well as our unprecedented efforts to reach out to veterans, family members, and survivors proactively and connect them to their earned benefits. Veterans like Oscar, a former active-duty Army and Colorado Air National Guard veteran who served 2 tours in Iraq. A few years ago, Oscar received the devastating news that he had advanced cancer. He submitted his claim for what he already knew was a terminal condition so he could ensure the family he loved was taken care of after he passed away. But since his claim was submitted and decided before the PACT Act became law, Oscar's claim was denied. When President Biden signed the PACT Act into law in August of 2022, Oscar's County Veteran Service Officer in Colorado, Chad Ferris, immediately gave him a call and walked him through the steps to reapply for his claim. Tragically, Oscar passed before learning that he'd been granted a 100% service connection for his cancer. But thanks to Chad's persistence and the provisions in the PACT Act, Oscar's surviving spouse and 4 children became entitled to benefits in his name. Thanks to the generous resources and authorities provided by Congress, we utilized the authority provided by the PACT Act to make all presumptives effective the day the bill was signed into law, rather than spreading implementation over several years. We also began processing all PACT claims on January 1st, 2023, instead of waiting 18 to 24 months for the completion of the rulemaking process, as is typically standard. We make these decisions so that millions of veterans who were subjected to toxic exposures while fighting for our country could receive the benefits they earned as quickly as possible. In the 2 years since the PACT Act was signed into law, VA has delivered over 1.2 million PACT Act benefits, equating to more than $7 billion to veterans and survivors. In fiscal year 23, veterans and survivors submitted 39% more claims applications than 2022, an all-time record. Today, more veterans and their families are receiving earned benefits than ever before. In this fiscal year alone, VA has already granted more than 1.1 million benefits, over half of which are PACT Act related, delivering $154 billion in benefits to veterans and survivors, another all-time record. And it's not just PACT Act claims that have led to this increase. Thanks to the largest, most aggressive outreach campaign in VA history, veterans, family members, and survivors are applying for a variety of benefits at higher numbers than ever before. To give you an idea of our efforts, since January 1st, 2023, we've held almost 18,000 events that included PACT Act briefings, with over 1.8 million direct engagements with veterans or their family members. This includes processing applications for education benefits, insurance, home loans, and more. When a veteran applies for benefits, our goal is to work with them to gather the necessary evidence to get to yes. And with this approach, we've granted benefits for 65% of claims and 75% of PACT Act-related claims, a sharp increase from previous years. Despite setting aggressive projections at the beginning of the year, the record-setting benefits delivered to veterans have exceeded our expectations and resulted in the need for an additional $2.883 billion in fiscal year 24 funding for mandatory benefits payments. This is money that goes straight into the pockets of veterans and their survivors. These funding estimates are conservative to ensure sufficient funding is available to get through the fiscal year and deliver on the promise to provide veterans their earned benefits on time, especially as VA continues to break records in benefits and health care delivery. Any funding shortfall of even $1 would prevent VA from processing its September pay file, and as a result, delay benefit payments to approximately 7 million veterans and survivors. We're committed to being transparent with Congress as well as veterans and their families on this issue. We were not willing to take the risk of potential delays in payments that veterans and their families have earned and deserve, which is why we elevated this risk as soon as we validated the potential need and why we are making changes to future budget projections so we don't find ourselves in this situation again. Our commitment remains steadfast. We're focused on delivering more benefits to more veterans and survivors more quickly than ever before. Thank you for your continued support. I appreciate the opportunity to appear before you today and look forward to continuing to work with you to improve veteran outcomes, and I'm ready to answer any questions you or other members of the committee may have.
Yeah, thank you, Josh, and there will be plenty of questions, and I want to thank you both for your testimony. Look, in my tenure on this committee, this is not the first time the VA has asked for additional funding. In this instance, the VA has, as you've already pointed out, Josh, and you too, Dr. Elnahal, had a very successful outreach around the PACT Act. It has prompted greater numbers of veterans, survivors, and beneficiaries to apply and to get those benefits. So the question is twofold, Mr. Jacobs. Number one, how do we end up here? And could you explain the timeline that the ranking member brought up in his opening statement and why the timeline was what it was?
Yep. Senator, thanks very much for that question. The reason we find ourselves in this situation is frankly, our workforce has over-delivered on what were already aggressive projections. For the last year, we've delivered more benefits to more veterans than at any other time in our history. Last year, we delivered nearly 2 million claims decisions. We set projections that we would deliver 2.2 million claims projections. And in the spring, when the Secretary testified before Congress about our budget, we were on track looking at our projections and our actuals. What happened is in July, as part of what we call the mid-session review, it's a statutorily mandated process, we updated our projections based on the most recent experience, and we identified that there was potential for us to actually deliver 2.5 million claims decisions. And so as we updated those projections, we then had to work to verify and validate that the assumptions we were making were in fact possible. And as soon as we did that, we communicated the risk and the potential need to Congress.
Okay. What percentage of the requested mandatory funding is administrative or overhead expenses, and what would leave I would guess that the remainder would go straight to the veterans, correct?
Mr. Chairman, none of the funding that we have requested is administrative. The entirety of the funding is going to support the delivery of care and benefits.
Okay. Thank you. You talked about it a little bit, but I want you to talk about it a little more. Tell me what the impact on veterans and their survivors if Congress doesn't do what we need to do and get the $2.883 billion out and then ultimately address the issue in next year's budget.
The risk of not receiving these funds by the 20th is that the funds would be delayed in terms of their delivery to veterans. Over many years, we've developed...
So talk about that delay. Are we talking of a delay of a week or 2 weeks, or are we talking how long?
Well, the majority of the funds that we provide are delivered through direct deposit. So 98% of our compensation and pension funds are delivered that way. We do have the ability to compress that timeline. The challenge is it increases the risk that something breaks in the process. But we can move that up and working closely with Treasury find ways to compress it.
Okay.
The real risk is the 2% of veterans and survivors, 140,000, the most vulnerable of our customers, many living in rural areas, more health conditions, older, would have a delay of up to 2 weeks.
Okay. And don't think I don't want to pick on you too, Dr. Elnahal, but this is another question for Mr. Jacobs. What new budgeting processes have you implemented since discovering the shortfall to capture the costs related to the PACT Act so that you can more accurately account for what the needs are out there, so we're not going to be here next September.
Yeah. We've updated our out-year projections for 25 and 26. One of the main lessons here is we can't underestimate the ability of our workforce to over-deliver. We're also working to increase the average rate at which disability rating increases. So for the last several years, we've seen an average increase in the disability rating of 1%. What we're seeing is it's actually increasing at a faster rate at 2%. So we're updating those projections to make sure that we account for the total cost increase, and then we're going to continue to work to refine that. We've also worked to more frequently provide reports to Congress, to this committee, to ensure that we're sharing with you monthly comparisons of actuals to projections to make sure that we've got transparency and close lines of communication.
I think you've already answered this, but I'm going to ask it anyway. Do you have all the tools you need to be able to address authorities and resources you need to be able to address the issue?
Yes, sir.
Okay. Thank you. Ranking Member Moran.
Chairman, Mr. Jacobs, I understand you're the one who's responsible for briefing OMB monthly on mandatory spending for veteran benefits. At what monthly briefing did you inform OMB of this issue? And how long after did you inform Congress?
Senator, our chief financial officer is engaged in those briefings, but what happened is in June, as part of the mid-session review, we identified this need. We then elevated it once we were able to verify the concerns and the assumptions here, and then communicated to Congress.
Are you telling, let me ask it this way, are you telling me that the decision to notify Congress when you did, and let me put what I think are the facts are, you just indicated that OMB was notified in June. The Milcon VA Appropriations Subcommittee didn't mark up a bill until July. Mm-hmm. And why did the VA wait until the day after that markup to start formally notifying Congress?
Senator, we had to work through a process of verifying and validating that our assumptions were right. So my recollection is this all happened towards the end of June, and we had a series of meetings with OMB to verify that the assumptions we were making in terms of the updated projections were sound. So a red team analysis, if you will. We had to work through that process and balance the need to ensure both timely reporting, but also accuracy.
No thought within the department's leadership that in the period of time between June and July that it might be useful to let Congress know that maybe something is happening before we make our decision about how we allocate spending between domestic spending and military defense spending?
Senator, I want to personally apologize for not calling you myself, as you referenced in your opening statement. One of my lessons here and one of our lessons is we will provide earlier communications. I will also say we didn't have a high level of confidence that we were working to get independent verification that the estimate was in fact real and the needs were verified.
Let me also, I appreciate the suggestion that there be additional communication, but let me also point out that Secretary McDonough responded to a letter from Chairman Tester and me on this topic in May. Mm-hmm. And I quote the letter, "We have the nationwide staffing totals we need to deliver the services at the nation, to our nation's veterans. In addition to that, the Secretary's testimony has always been that we seem to be doing fine, and if we need any additional help, we'll let Congress know." And what I've seen in the press, that's been the explanation. Well, we told Congress that we might need their help, so we don't feel like we weren't disclosing appropriately. But it does seem to me that the lack of certainty with which you claim that you didn't know for certain about the amount of money, but you knew that there was something was happening, and in both a letter and in testimony, the indication would be Congress would be informed. And it has a lot of consequences as we do our appropriations process. And as I said, we only know this after we mark up Milcon VA. Let me move on a bit. Mr. Mr. Jacobs, one of the documents that the VA shared regarding the shortfall indicates a projected additional need next fiscal year of approximately $22 billion. Is that accurate?
I believe it's in that range, about 20 billion or so, correct.
And let me, because we've not had the chance to talk about this issue in a hearing, I don't think we've been in this room for months, I want to talk about the bonuses. Both of you used the authority, your authority, to award bonuses ranging up to $100,000 for 182 VA senior executives in the VA central office. A total of $10.8 million in CSI payments were spent this way. Is this appropriate? Are you satisfied with the decision that you made? Is there any admission that it's a mistake, or it's just that Congress caused an uproar and it didn't look good and you tried to alter the circumstances that you created?
Senator, we made a mistake as an organization, and I made a mistake personally in the way that we handled the CSI payments to senior executives in central office. And as we identified and reported with the Inspector General, once we confirmed the mistake, we communicated to you, to this committee. We began the process of recoupment, and we have to date recouped 93% of the bonuses or the CSI payments, and we're in the process of getting the remainder. But what I will tell you is I'm mindful that trust is a key priority for us, and that if we don't have trust, we're not going to encourage veterans to access their earned benefits. So to the extent my actions and the department's actions imperiled that trust, I want to apologize and take ownership for that and make sure that we never repeat that mistake again.
Trust is important, and communication is a significant component of the capability of having trust. And I would encourage you, again, the Secretary and both of you are very kind in the number of times in which you call and give me information. You just referenced one of them. But it seems to me that when the billions of dollars that we had in shortfall appeared, that this circumstance was worthy of that same kind of notification so that we could make decisions, and not just me and not this committee, but the appropriations process and the leadership of the House and Senate. Thank you.
I'm substituting for Chairman Tester, and
You're doing a very fine job. I like this.
well, don't reach any hasty judgments. With your guidance, I'm sure I will. Senator Hassan.
Thank you, Senator Blumenthal, and my thanks to the Chairman and Ranking Member Moran for this hearing. Look, the VA does essential work to provide care and benefits to our veterans, including through the PACT Act. But I join my colleagues in being very concerned about the budget shortfall caused by the VA's miscalculations, and so are the Granite Staters who've reached out to my office. As I discussed at a recent roundtable with veterans in New Hampshire, while I'm pleased that the VA has provided services and benefits to many PACT Act veterans, it's unacceptable that the veterans' benefits are now at risk due to the VA's inability to properly plan for that very influx of PACT Act veterans. The VA has to do better. We have to do better. Mr. Jacobs, I wanted to start just by following up on your answer to Chairman Tester's question about what are you doing to make sure that this kind of budget miscalculation doesn't happen in the future. You said, if I heard your answer completely, essentially that you made some mistakes with projections, how fast and well the workforce could work, but also some other projections. But what in the process moving forward are you changing so that this doesn't happen again?
I think that the largest driver in the process are the inputs and the assumptions. And it's frankly, it's also going to be the frequency with which we report out to make sure that we're transparent. In the springtime, what we identified is that our spend plan was nearly on track with our projections. And so we're maybe 0.5% off for both the education and the comp accounts. And so we'll continue to do that and make sure that as we update our projections, we can communicate transparently and with vigor.
And I think from what you're hearing from the ranking member, and I assume you will hear from others, and with communication as frequently as you can with us, even when you're not quite sure what the actual information is going to turn out to be. Dr. Elnahal, I want to turn to you and healthcare. As the VA has provided healthcare to more PACT Act veterans, the department is living up to its mission of caring for those who've served. That care, though, isn't confined to 1 year or one budget cycle. It's a lifelong commitment that our country has rightly made to our veterans. The veterans now covered through the PACT Act are going to receive care through the VA for decades to come. So what is the VA doing to ensure that it accurately projects the level of resources, including funding, that is necessary to provide health care for our veterans in the long term?
Thank you for the question, Senator. The main driver, as my colleague mentioned, for our need for additional funds is greater care delivery than ever before to more veterans than we anticipated, both enrolling and having their priority groups increased because of the hard work that VBA employees have done to grant more service connection. And so our efforts to improve our predictive models for our budget needs are going to take better into account three main factors. The first is our unprecedented outreach. Historically, VA has not necessarily been present in communities where veterans are at nearly the frequency where we are now. And I hope to be able to make sure that we project the result of that, which is more veterans finding out about their earned benefits and healthcare opportunities and enrolling with us. The second is the combined policy effects of the Mission Act, which has allowed more veterans to get care in the community to meet their needs across the country. And also the PACT Act, because of the dynamic I mentioned around priority group increases, which confer new healthcare opportunities to veterans in long-term care, dental care, and other services. Now, this, I think, was an underappreciated factor in our projections, and we will make sure that we take them into account into the future. But combination of policy and unprecedented outreach, Senator, we have to take those better into account as we project future budget needs.
Right, and just to be clear, when I'm meeting with my veterans, a lot of them still don't feel like they get great outreach, and a lot of veterans still tell me they weren't fully aware of the range of benefits or health care available to them. So you guys are really going to need to kind of think through the ripple effect here, right? And the compounding effect, which is a good thing that we should be hoping will happen, but what we're really looking for is processes that will capture that, right? Yes. I may follow up a little bit more on that, but I just wanted to close with adding my concerns about the improper issuing of bonuses. The VA Inspector General's office found that the awarding of almost $11 million to central office executives within the VA and the VBA, your respective offices, were inconsistent with both the PACT Act and the VA policy. So this wasn't just a mistake. You've got the Inspector General's office saying, you guys just didn't follow the law and follow the policy. I know that you've worked to recoup the bonuses, but with the chair's permission, I would like you both just to talk a little bit more about how you can explain your role in and responsibility for the improper issuing of these bonuses, and how do you plan to ensure that it doesn't happen again? Mr. Jacobs.
Senator, we had a number of process shortcomings, so we didn't have the right level of lawyers to review. There were concerns that were raised within our HR function that didn't get elevated. So we have to improve who's involved in the decision-making process. We also have to ensure that we have the right level of independence so that there are no conflict of interest. Part of that process is to ensure that all CSI payments in the future that go to executives are delegated to only be approved by the secretary.
Dr. Elnahal.
Senator, just to add to that, my ownership of my personal mistakes, mistakes made within our healthcare system on this, they simply will not happen again because my attention will be on implementing all of the IG's recommendations. And finally, I think one of the biggest gaps was not bringing this proposed set of incentives forward to our broader governance process so that our general counsel's office, our human resources office, senior leadership, and other really important stakeholders could have weighed in. In my case, we issued incentives to many more executives than I had originally anticipated. All of this would have been caught if we had put the proposal through our governance, and it will not happen again, Senator.
Well, that is good to hear. Just be aware that other offices of the VA didn't take this opportunity to give bonuses to senior executives, because I think they understood that was not the intention of the bonus system. Thank you, Mr. Chair.
Thanks, Senator Hassan. I would be next, but I'm going to defer to my colleagues who are here. Senator Blackburn.
Thank you so much, and thank you all for coming back to visit with us. I think you know we're all concerned about the shortfall, and hopefully we get legislation over here this week from the House that is going to patch that. I've listened to your answers, and honestly, I don't see, there's a lot that just does not seem to add up. How you could not have seen this coming is perplexing. So talk to me for just a minute about the added transparency and what you're going to do to improve that annual budget process. You were saying you were looking at $20 billion more in benefits. I think that's right, Mr. Jacobs. And Senator Sullivan has proposed a bill, and I'm co-sponsoring this, that would require you to provide regular in-person budget reports to Congress, because your numbers have been so far off and your expectations have been so far off. So I'd love to hear from each of you on that.
Yep. Senator, I'd be happy to increase transparency and communication. We previously provided quarterly spend rates. Right now, we've increased that to monthly, and be happy to do that in person. The approximately $3 billion that we've requested in mandatory funding is a little less than a week's worth of payments that we provide to veterans and their families. So in terms of where the projections were relative to the total amount, relatively small, but obviously a large dollar amount. In terms of the process improvements, we are making certain adjustments to our inputs and the assumptions. I discussed that a little bit earlier about the total number of vets served and the average rate of that increased disability compensation. And then as we do that, we'll continue to communicate with this committee and others in Congress to make sure we're
Okay, let me ask you this. Was the communication gap that caused this shortfall, was it between the veterans and the caseworker, and your offices? Where did your numbers fall? How did you get so far off track? And I know you've said, well, we've done more outreach. Well, we've done this. Well, we decided to change how the PACT Act was going to be implemented. But there should have been some form of communication that said we've got a hiccup in the system and we need to fix this. And to have come before us and not brought it forward and then immediately after say, hey, we've got a problem, it looks very suspicious. Our job is to make certain that veterans get what benefits they're entitled to.
Yep. Senator, as we were monitoring our spend plan and comparing the actuals versus the projections, what we identified in the second and third quarter is that we were actually quite close, and in fact our spend rate for compensation and pension was actually under the projections. What transpired and changed in that June-July timeframe is we updated our projections. So based on new analysis, we identified the potential risk for the need of additional mandatory funding. And the challenge here—
So you don't do this on an ongoing rolling basis. You periodically do updates. So do you need different technology?
No, Senator. I think what we have to do is just continue to maintain the frequency. Yep.
All right, Dr. Elnahal.
Senator, absolutely. So we made very explicit policy decisions, including accelerating eligibility for many more categories of veterans as of March 5th of this year. 50,000 veterans have since enrolled from that authority alone, on top of 750,000 vets since the PACT Act was signed. We should have been more communicative. I will definitely concede that to you, and we will work on that. We've been monitoring budget execution as we normally do every single month. The main driver of this is delivering more care to veterans than ever before. And we stand by our decision to open the doors into the healthcare system for more veterans. But I pledge to you that we will be as transparent as possible as we move forward. And we do think this is a good investment for future veteran care into the next fiscal year.
Okay, let me ask you one quick thing about these CSI bonuses, because I think this was astounding. that bonuses of up to $100,000 were being given. Were any of these individuals that got bonuses working remote, part-time, or were all of them in person 5 days a week?
So we have a policy for our headquarters, Senator, where folks have to come in 5 days per pay period, which is 2 weeks. So about 5 days every 10.
So they're able to work remote part-time, and they're going to get a $100,000 bonus, and we have a budget shortfall that we can't take care of the veterans and provide them the benefits they have earned.
Senator, listen, I concede that we made mistakes on this as soon as we discovered, especially in my
My time
case.
has expired. I'm going to send it back to the chairman.
Thank you, Senator. Senator Tuberville.
Thank you, Mr. Chairman. Thanks for being here today, both of you. Very important. You know, our VA, especially in my state, we have so many veterans that we do it the right way. We give the best possible care, biggest health care system in the world. I get more complaints about this than probably anything that I do, but we just got to make sure taxpayer dollars are spent in the right way, but we want to take care of our veterans. First of all, bonuses, Mr. Jacobs, are these for doctors or administrators, these bonuses?
The majority of the CSI payments that have been paid out by the department are going to frontline workers, and that ranges from environmental technicians who are keeping the hospitals clean to HR staff. The CSI payments that were provided inappropriately were done to leadership in the central office.
Is this merit-based or seniority?
So the requirements under the law are that they are positions that are in high demand and short supply, and the jobs that are relative to their specific position and critical skill.
You know, we talked about projections. How often are your projections internally verified? I mean, do you internally go back, have people checking? How often does that happen?
It's several times a year. We work to update our projections. We have two teams, one in the Office of Field Operations, one in our, what we call the PA&I Performance Analysis and Integrity team, that they run different models and they work against one another to verify the projections and to stress test it. We then do that again, and as we did most recently in June, where we work to update the projections versus actuals based on the new real-time data that we've identified.
As much money as we're talking about here, do we use any outside accounting or entities to go through these projections at all, or is it just all in-house?
I believe it's in-house. I'd have to double-check and make sure that I'm not unaware of any additional outside review for the VBA process.
All right, Mr. Elnahal, 2025. I think my staff was briefed that we're going to have a $22.6 billion shortfall. Is that correct?
It's about a $12 billion potential shortfall into fiscal year 25 for medical care.
Yeah, for 25, have we projected that for the year 25, or is that what you're talking about?
For fiscal year 25, yes, Senator.
Okay. Mr. Elnahal, since the PACT Act, the VA has announced that they have hired more personnel than ever before. And at the same time, community care referrals, especially in my state, have continued to go up. Healthcare providers in the Gulf Coast VA healthcare system have told me and my staff that they are overwhelmed with patients, and they're having to heavily lean on community care, which the VA claims is a leading cause of the VHA's budget problem in the first place. How can we be confident the VA's long-term hiring strategy, given the increase in hiring, should mean less community care? I mean, to me, that's an oxymoron there.
Well, Senator, we need this $12 billion to grow both direct care and community care, and we're up 10% in established patient appointments, nearly 7% in new patient
We're hiring more
appointments.
people, right? We're hiring
That's
more
right. So we're delivering more care in the direct care system, Senator. At the same time, we're also at about a 14.5% growth rate in the community care budget. So the $12 billion will support growth in both accounts, direct care and community care for veterans, and also help us pay for increasing costs for pharmaceuticals and prosthetics that veterans need.
Yeah, and with this PACT Act, we were hoping this would happen. People would come and
Yes.
and take advantage of this. And so what is the VA's plan to prioritize healthcare worker hirings, especially in mental health?
Well, Senator, even during this fiscal year, which has been a tighter picture than recent years, we have told our medical centers to strategically hire, especially in mental health, but where veterans needed clinical care the most. And so as a result, we've actually grown by just over 2% this fiscal year, even though our original goal in terms of maintaining our all-time high veteran trust, quality and patient safety outcomes, we thought we could achieve that goal with level staff. But our medical centers did the right thing and hired anyway because that's what they felt we needed, and they've been delivering on it with more productivity and more care to veterans. So the additional money will allow us to grow further by an additional 5,000 employees to be able to meet even further needs.
So since the PACT Act last 2 years, have we seen more people come for help with mental health?
Yes, Senator, this mental health demand is significantly up, 15% more new patient appointments in mental health this year than last year. And we also have increases in all categories of mental health, including telehealth episodes of care.
I hope we're looking at the new avenues of mental health, helping mental health. There's some things that hopefully we get in the next budget that we can help doctors with that are really helping PTSD. I know for a fact that they've helped in the VA in Arkansas. A friend of mine runs the VA there that's really helped. So it's going to cost money, which everything does, especially in healthcare. But thank you very much. Thank you, Mr. Chairman.
Senator Hirono.
Thank you, Mr. Chairman. So I realize that we're going to need to, Congress will need to provide you with close to $3 billion just to get us through this current fiscal year, right?
Yes, Senator.
And then you're going to need another close to $12 billion for fiscal year 2025. So yeah, well, yes, you have been asked questions about how your budgeting process and your ability to accurately determine what the fiscal needs are. So do you have this is for both of you, do you have the tools that you need to accurately project your funding needs? And whether that projection could come to us earlier in the year than this kind of, I view a $3 billion request right now, which we have to do, I believe, in the Senate tomorrow or today. You just can't keep doing it this way. So do you have the tools that you need? Do you have the people with the ability to make this assessment? Do you have whatever other tools that you need to make better predictions?
Senator, from a VBA perspective, I believe we do have the tools. I think one of the key lessons learned is that we should not underestimate our workforce. They over-delivered on what we thought were already aggressive projections. So we're increasing the total number of veterans we anticipate being able to serve.
Excuse me, what do you mean by they overperformed? Well,
So at the beginning of this fiscal year, we projected that we would be able to deliver 2.2 million claims decisions, which was about 200,000 greater than we were able to do in the previous fiscal year. And we've already surpassed 2.4 million, and we're on track to complete 2.5 million claims decisions. So we're delivering more benefits to more veterans than at any other time in our history.
so in terms of your claims decisions, you have gotten a lot better?
Yes, Senator. And
That's good.
And Senator, if I can just add, I recognize I'm a temporary steward of this role. I'm not going to be here forever. One of the things I want to impart on this organization is to take the right lessons from this experience. We could have stopped the outreach. We could have slowed down claims processing or stopped claims processing to meet those targets, but we chose not to because we wanted to keep our foot on the gas. And as soon as we realized it, to make sure we're delivering as many benefits to as many veterans as possible.
Yes, I commend you for making your claims process, that decision-making process, and your review process much more expeditious, because that's been one of the complaints from veterans, that it takes forever for different decisions to be made that would impact them. So you got that part going, but now you need to better estimate whatever it is that you need, so that we are not left with having to provide really substantial amounts. Now, one of the other things that I and you're improving on that, that's what you're telling me. So for Dr. Elnahal, I think I heard you say that VA has not been present where the veterans are? I heard you say that. Meaning, so do you have a map or some kind of a population data as to where all your veterans live? Because that's how I interpret what you mean by VA is not where the veterans are. So this says to me things such as we need more CBOCs, for example, so that the health care can be provided where they live. Is that what you're talking about?
I was referring to our outreach efforts, Senator, the fact that we've done thousands of outreach events in communities alongside our colleagues in the Veterans Benefits Administration to help make veterans aware of their earned benefits and healthcare opportunities has led to 750,000 veterans enrolling since the PACT Act was signed and 900,000 veterans being upgraded in their healthcare coverage so that they can qualify for new services like dental care and long-term care.
I think that is another aspect of what needed to happen is that your outreach efforts, because there are a lot of veterans, particularly I would say, not necessarily the World War II or the Vietnam vets, although there are issues there, for them to understand what their what the programmatic support is. But at the same time, we need to, I would say we need to distribute a better place where they can go to have their healthcare needs met, which means, in my view, CBOCs. So I am a big supporter of CBOCs going where the veterans are. So do you have a plan for distributing the healthcare capabilities to where the veterans are?
Yes, Senator, and one of the main drivers that compelled us to come to Congress to ask for $12 billion in additional funding was our ability to actually activate new clinical space in some of the fastest growing areas in the country that need a presence closer to them. On top of that, we have a lot more programming, Senator, that's growing significantly that brings our VA teams into veteran homes and communities. So we have home-based primary care. We have a lot more telehealth happening, 15% growth year over year. And we're really trying to, with programs like the Closer to Me program for cancer therapy, bring our complex cancer infusion teams closer to rural communities and veterans who live in more remote areas to bring that care closer to them.
Thank you. I commend you for all of those efforts, but obviously you need to better assess what your resource needs are so we can be on the same page. Thank you, Mr. Chairman.
Senator Bozeman.
Thank you, Mr. Chairman. I want to thank both of you for being here today. As elected officials, we require consistent and forthright communication to ensure the VA receives the resources required to fully serve veterans in our communities. Anything short of that risks us into situations like we are in today, where Congress must make a significant budget shortfall on extremely short notice. At the VA's budget request hearing in May, I raised my concerns about the decrease in the veterans' health care request and asked what risks the VA's budget would open. I appreciated the work that the VA had done, but remained concerned that a shortfall of this size was not anticipated. It's unfortunate we now find ourselves in a situation where veterans' benefits are at risk. I've had the pleasure of serving on the Appropriations Committee subcommittee for Milcon VA, being the lead Republican on that right now, which funds the VA's yearly budget, along with this committee. Of note, the VA's announcement of the shortfall came shortly after that committee agreed on top-line funding and marking up what that particular spending. You know, it's interesting, in my comments as we were passing that bill, I explicitly said that I was very concerned about the numbers. Senator Collins, in her statement, she said that she was very concerned about the numbers. I guess my question is, why was my staff more aware of this than your staff and you, Mr. Jacobs?
Senator, in the spring, around the time the Secretary was testifying, we were closely monitoring our spend plan and comparing our obligations to our projections, and we were pretty much on track. We were quite close, and so while we were close, we were monitoring it. We didn't have reason to believe that we would need additional funding. What happened is in June, we engaged in the mid-session review as part of that statutorily mandated process to reconsider and review with OMB our numbers. And while we did that, we updated the projections to include real-time data and our experience to inform how we thought the rest of the fiscal year would proceed. What we identified in that June timeframe was the potential need for additional mandatory dollars in order to ensure that we could provide all veterans and survivors.
No, I understand, but again, as we were doing the markup for that bill, as was testified to here, my staff and the majority staff were very concerned that the numbers just didn't add up, okay? They didn't need a June whatever. They just knew, because they follow those accounts very closely, that what you were asking just didn't compute. It didn't make sense. And you weren't off $1 billion. You weren't off a little bit of money. You were off a tremendous amount of money, okay? So that's the situation that we find ourselves in. And then literally, like, the day after we do our appropriations, you come out rectifying it, and that's not a good look. How do you believe OMB's understanding of funding needed for the VA compares to the VA's understanding of required funding?
I think we're on.
OMB's got their ideas, you've got yours. What's the delta? Do you all agree?
Yeah, we agree on the total needs for mandatory funding.
Okay. How much do you assess that the accuracy of the VA's budget formulas contributed to the shortfall?
I think we have a number of lessons learned from our budget forecasting. One is we need to increase the total number of veterans we project we can deliver benefits to, because our workforce has been delivering at a very high rate. Second is we need to better incorporate the increase in the average disability rating. Historically, it's increased about 1% per year. What we're seeing more recently is a 2% increase, so we need to take those factors into consideration. And three, we need to improve our process, so that includes monthly reporting to your committee, to the authorizing committees, to make sure that we're continuing to communicate as we know in real time, even if we have not yet fully verified the potential need.
Okay. So if you'd done that, we wouldn't have this problem now with not being $1 billion off or $2 billion, but many, many billions of dollars off. That would have prevented the situation that we're in now.
Well, Senator, I think we'd still find ourselves in a similar situation if absent the forecasting assumption changes. What we're finding right now is that the actual spend is below plan. We're maintaining the request is still merited because we need to be conservative in the mandatory spend. If we're even $1 short, we will be delayed in our ability to deliver timely benefits to veterans and survivors.
So how much more are you asking than you really don't think?
We're asking for what we requested originally.
And how much more is that than you really think you need?
Right now,
according to your projection.
Right now, we anticipate we will. We're about 0.9% under plan, but we're still going through the end of the fiscal year, and our workforce historically in September really puts on the gas and moves forward very high.
Okay. Thank you all very much. Thank you.
Senator Cassidy.
Thank you. Dr. Elnahal, thank you again for that phone call yesterday. I appreciate that. I understand you spoke with my staff. I appreciate that. Thank you. Mr. Jacobs, it's my understanding that the VA has hired 10,000 employees, additional employees to implement the PAC Act.
Senator, we've grown by 35% over the last 2 years. So that's about 10,000 employees. Yes, sir. It's PACT Act, but also other benefits as well that are associated.
A lot of employees. Others are doing more with less using AI and computing. It seems like we're doing less with more. And I say that not to be pejorative,
Yep.
but that's just a trend, and it doesn't seem like it's working here. How many of those employees work remotely? What percent?
Senator, our workforce in the regional offices come into the office 2 days per pay period. The
Per
employees
pay period
is 2 weeks.
every two, so they have to come in, they could come in on Monday, and then they could come in 2 Fridays later.
At a minimum.
Now, is there any coordination? Okay, we have a team working on this project. You're all going to show up on Monday, and we're going to go over as a group exercise what we need to do, or do people just pick the day they come in?
There is coordination across different business lines and regional offices to coordinate that. But what I'll say is the work that's conducted, particularly by the claims processors, is very individual. It's heads down, working through issues. And what we found
And
is
how
that
does
they're
the
more
VA
productive.
monitor productivity?
We have performance standards that we apply to all of our employees, that they have to hit those standards, both in production and quality, so we can determine whether our employees are meeting their production. And what we've seen over the last few years is they're delivering more benefits to more veterans than at any other time in our history.
Now, of course, it's partly the fact that they have more benefits to bestow. I'm not sure I'll accept that that is a measure of productivity.
Well, we have measured productivity in terms of claims decision per employee. It's increased over the last couple of years. This year is a little different because we have so many new employees. But to your earlier point, I do think, as you think about people, process, technology, the majority of our production output is people-based. It is our existing workforce, it is the new employees, and until recently, it's been a reliance on mandatory overtime. We have not received as much lift from process improvements in technology. We are in the process of implementing what we call automated decision support. We're increasingly leveraging technology, and that is the future where we have the most potential so that we can give our employees more tools to deliver more benefits more timely, accurately, and equitably. And I think we, as we look to the future, we'll have the opportunity to do a whole lot more for veterans as a result.
Who is developing that automated decision support system?
It's a vendor, I believe it is IBM, but I'd have to verify that.
And when is it to be delivered? I mean, is this kind of like in some agencies where whenever they finish it, it's finished, or is this something where you have a hard and fast, this shall be completed by this date?
We have very clear project milestones. We have automated hundreds of diagnostic codes, and we're working in a process to verify, validate, and graduate those. So we have certain regional offices that have been in the process of testing the implementation, providing direct feedback that's being used to improve it. Then we move it to another regional office or a set of regional office where they then continue to refine it and then deploy it nationwide. So I'd be happy to follow up with you or your staff to walk through that milestone schedule.
That would be good. The EHR effort has obviously not gone well, and so the question is, will it be, where on the spectrum will it be in terms of actually being developed? This also suggests to me that it's ideal for what I understand a large language model can do. So is this conventional decision to support, or will this be a large language model looking at patterns and saying this person, we all need to review them, but these are the ones which need particular review and these are the ones which seem routine, that sort of decision support?
What we're utilizing right now is optical character recognition, so it's enabling our employees to see the evidence that they need.
Now, OCR, I think, merely takes a PDF and it makes it into a digital format.
Correct.
That is still using the human in order to make a decision. It is not using the computer to aid that decision.
Correct. We are working to optimize and enable computers to do what they do best, and while still preserving the human element where it's needed and required under the.
So I'm still losing it a little bit.
Yep.
Again, AI, large language model, is touted, it appears it can look at a pattern and make a decision that otherwise perhaps an employee would have to.
Yeah.
So that's different than optical character resolution.
Correct.
So if all you're doing is OCR, I'm very discouraged.
Well, this is a multi-phase process. We are utilizing elements of AI to improve the way that we enable our employees to look at what we call the manual. This is the guidance for how we adjudicate claims. It often changes on a regular basis, and it's the basis for the decisions that we make. We're still relatively early here. There's a significant amount of case law that we have to navigate. We also have to employ trust, because one of the things that we've realized through previous previous deployments of technology is that if our employees don't trust it or they think it's going to come for their jobs, they're going to find workarounds. So we're in an incremental process of utilizing technology so that we don't disrupt it, we don't have delivery breakages, and that we can continue to optimize the ROI for this.
If we've hired 10,000 people, we got billions of overruns, and we're still way behind, I got to tell you, you need some change. And if it's going to be limited by people who say, wait a second, they may come for my job.
Yeah.
I mean, the veteran is not being served. It's not about the person's job, it's about the
Yeah.
damn veteran. And why do we, I'm sorry to be frustrated.
Yeah. Senator, we're delivering more benefits to more veterans than at any other time in our history. So to put this in perspective, a decade ago, when the backlog was at its peak of 611,000, the backlog was 70% of our total inventory. Today, it's 25% of the inventory. The average claim 10 years ago took 378 days to process. Today, it's taking 152.
What I don't know is if that claim is being just whisked through or if it's truly being processed. If you never actually, just click, 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 it can go through without an appropriate process. I think I've kind of made my point. But if we should be doing what others are doing in terms of better serve the veteran, we should not be saying, wait a second, people may think we're coming for the job, so we're not going to do it after all. That is discouraging. I'm sorry to be a downer. I yield.
Senator Brown.
Thank you. I don't think you're a downer, Senator Cassidy. You do good things, so thank you for that. And I take a different viewpoint. I take one, perhaps a bit of celebration about the effectiveness of the PACT Act and what you all have done. I understand the oversight we need to do with the VA, but I also understand you recognize something when it really matters. Senator Blumenthal, thank you. Senator Moran, thank you. Mr. Ranking Member, I'm proud of the fact that more veterans than ever are getting benefits they've earned. The PACT Act is named after an Ohio veteran. I know his widow, I know his daughter, and I know his mother-in-law, and what we have been able to do collectively, both parties in this body, this committee especially. Senator Moran, I thank you. I thank Chair Tester and Dick. I thank the work you do. Is pretty remarkable. 32,000 veterans, and remember we passed that bill in, I believe, August, September of 2022. Some people said it was too expensive. Those same people never seem to think it's too expensive to send people to war. It's only too expensive to take care of them when they come home. So they lost that argument when they said, stop, don't do it. But you think of the success. The millionth veteran in the country has gotten coverage and care, 32, 33, 34,000 in my state. And in so many ways, the PACT Act's a victim of its own success. Because of this increase in veterans, I don't think any of us probably predicted it would take hold that quickly. The first became law in January of 2023. This is about 18 months later, give or take, and look at its success already. Delaying the funding, not passing this bill would have terrible consequences. Delaying the funding would postpone benefits payments. It would, including disability payments, GI Bill payments, benefits. These are payments that veterans and caregivers and survivors count on. If those checks don't come on time, many of these families have already sacrificed. You know all this. Many of those families that have sacrificed we will not show our appreciation for their sacrifice, and that's why this is so important. Senators Murray and Collins and Tester and Bozeman and Sinema and Moran and I introduced the Veterans Supplemental Appropriations Act. It should have already passed. We pushed Congress starting nearly 2 months ago, so veterans and families wouldn't have to worry about how they're going to make a house payment, a car payment, or feed their families. But better late than never. We know what the House did last night. A lot of politics played on the House floor, but in the end, reason prevailed, and they passed it by voice vote. So one question. I talk with county veteran. Ohio, as you may know, each of our 88 counties has its own veteran service office. Some as small as 2 people. Franklin and Cuyahoga, I think, have 50 or 60 people whose job it is, funded in large part by the county, whose job it is to take care of any veterans issues that they confront. They have told me, many of the veterans who receive compensation and pension benefits, this is their only or their primary source of income. So means these veterans could be forced to go even a month or two without any income at all. Veterans shouldn't have to pay that price. So if we don't get this done by the 20th, talk through that. Is there anything the VA can do to ensure that veterans receive those critical payments? Either of you, if you would answer that.
Yep. Senator, it's our hope that Congress will take action. We were encouraged by the House action last night and confident that the Senate will follow suit. If it turns out that we're not able to secure the funding by the 20th, we will work to communicate with veterans to ensure that they have letters to relay to their financial institutions, to their schools, to anyone that they may need to make a payment to, so that they understand that the payment could be delayed by up to 2 weeks in the case of those veterans who are receiving paper checks.
Okay. Thank you, Dick.
Thanks, Senator Brown. Senator Sullivan.
Thank you, Mr. Chairman. Gentlemen, I am concerned about what's happened, you know, the processes in which we find ourselves again. This has happened a number of times, to have a $3 billion shortfall on 6 weeks' notice, or we're going to jeopardize other benefits. I think it's a failure on leadership, and to be honest, I'm disappointed the Secretary wasn't here. You guys are doing a good job answering the questions. But when something of this magnitude happens, and it's not the first time it happens, and it's based on, some of the concerns are based on a recent OIG Biden administration Inspector General report over at the House Veterans Affairs Committee, I think it's really incumbent upon the Secretary to be here answering questions, but I guess that didn't happen today, so appreciate you two being here. Let me read a little bit from this OIG report that just came out recently, Mr. Chairman. I think it's already in the record, but I'd like to submit it for the record. This is the September 10th Inspector General for the Veterans Affairs report. They said, quote, the OIG staff routinely finds breakdowns in processes, infrastructure, governance, leadership, and other failings that erode the foundations of elements of accountability at the VA. These breakdowns impede the VA's efforts to make certain that patients receive timely, high-quality health care and that veterans and other eligible beneficiaries are afforded the compensation and services they are owed. Have you guys, any of you read this?
Yes, Senator.
What do you think of that statement?
I think the OIG helps us improve every single day, and it's incumbent upon us to implement all of their recommendations in the healthcare system to make our services and healthcare more reliable. I will say, Senator, that I'm proud of our overall outcomes on average when it comes to veteran trust, an all-time high of 92% for outpatient care, beating the private sector for the 9th consecutive quarter in the row for inpatient care. But there are definitely areas where we need to improve, and it's part of one of the most important parts of my job to implement IG.
Let me go to the issue of accountability, because I think they talk a lot about leadership and accountability. They talk about the need for a sustained effort to change the culture at the VA, where leadership management officials are often not held accountable. That's, again, the OIG. I recently introduced legislation called the Pro-Vets Act. I already have 14 co-sponsors, 5 of which are members of this committee. One of the things it says is that it goes into the issue of accountability by building on quarterly report requirements that were included in the House bill last night, by requiring an in-person briefing from the Secretary on these accountability requirements. Would the VA be okay with that? That's leadership, that's accountability, coming before this committee. That's what I'm trying to get done right now as we speak. I think just throwing $3 billion right now, hey, Congress, you got 3 days for $3 billion without any accountability reforms kind of misses the point. Or would you be okay with that? Quarterly from the Secretary on accountability? Supposed to be doing it anyways.
So, Senator, obviously we'll review that bill closely, work with you on technical assistance.
Let me do another one, which is if there's a VA shortfall outside regular order, this is in my bill, then the staff responsible for the budget in both OMB and the VA would not qualify for a bonus. Would you be okay with that one?
Pending legislation, Senator, we'll look at it and make sure we offer technical
So I'm trying to
assistance on
get
it.
at this issue, Mr. Secretary, Mr. Undersecretary. The VA gave out $11 million in improper bonuses in May of this year. Are you familiar with that?
Yes, Senator, and there were mistakes across the agency. I made personal mistakes in not understanding exactly how many awards were ultimately approved, but
Was anyone held accountable or fired or relieved of duty? If you mentioned the private sector, private sector company came out with $11 million in improper bonuses to the employees and then came to their board of directors, which is what we are, your board of directors, saying, oops, we need $3 billion more, those people would be fired. Was anyone held accountable for the $11 million in improper bonuses coming out of the VA? Anybody?
we concurred with the IG's recommendation to evaluate for possible discipline.
Not answer my question. Was anyone held responsible for the $11 million of improper bonuses paid out by the VA?
The Office of Accountability and Whistleblower Protection will help us with that question, Senator, once
the
they
answer is
complete
no?
their analysis.
Right now, the answer is
Not yet, Senator. We have to wait for that.
okay.
analysis.
This is why, look, I have more veterans per capita. I work with the VA all the time, but this is why some veterans, and even on this, right, we're scrambling $3 billion, or veterans aren't going to get their benefits. Well, we don't want that to happen. We'll work through this, but there should be accountability. Don't you guys agree? I know you're spinning this as, hey, this is a great victory. It's not a great victory. Come on. We're scrambling at the end of the Congress here to get $3 billion, or my constituents won't get their VA benefits. That is not a great victory. So I wish you would quit spinning it that way. It's a failure in leadership and management. And don't you think if we're going to do $3 billion again, I forgot what the Denver hospital was, Senator King, and we all worked on that one, if you remember. Last minute, we got to fund this hospital, $3 billion, I think it was, that there should be accountability standards when we're doing this. I think we're becoming numb to this, and I don't think that's a good thing for this committee in terms of oversight. So should there be any additional accountability measures as we work to quickly scramble for $3 billion to make sure veterans in Connecticut and Maine and Alaska don't get cut off here in the next couple weeks? Should there be? Would you guys entertain them? Take a look at my bill?
Senator, we'd be happy to take a look at your bill and follow up with you and your staff to talk about it once we've had a chance to review it.
Okay. I have some questions for the record, Mr. Chairman, but I appreciate that. Thank you, gentlemen.
Thank you. I'm going to ask a couple of questions and then call on Senator King, or if you want to go ahead, Senator. I'd just like to make the point about these bonuses. Isn't it a fact that almost all the improperly paid or allegedly improperly paid bonuses have been recovered, clawed back?
Senator, we're at about 93% of the bonus amounts being returned back to the VA.
And nobody likes shortfalls. We all want projections to be accurate, but the PAC Act really is a success story, in my view. And part of it is on us. I've been going around the state of Connecticut at every veterans group I address, every time I'm talking to a veteran, even in unrelated groups. Any veterans here, raise your hand. Go sign up for the PAC Act if you haven't done it. That's what I say today. That's what I say to groups. It could be Rotary clubs or anybody else. I've been trying to get the word out because my fear has been that our veterans wouldn't take advantage of this program. So I regret there's a shortfall and that we are, to use Senator Sullivan's word, scrambling. But hopefully, if we act in time, nobody's going to be hurt. Is that correct?
That is correct, Senator.
Thank you. Let me ask you, I'm very curious, do you have percentages, or can you give us kind of a factual picture of what kinds of illnesses or conditions have been most common among the ones covered by the PAC Act? In other words, is it cancer? If so, what types of cancer? I've known people who are suffering from cancer who are taking advantage of it, but I'd be interested to know what are the conditions most commonly covered?
Senator, it's predominantly been respiratory issues and certain cancers. I'd be happy to follow up and provide the details. We also have had significant number of Vietnam veterans with hypertension who have applied for and received PACT Act benefits. And one of the other great benefits of this law is that it's encouraged other veterans who are not eligible for the PACT Act to come out and either give VA a shot for the first time or try it again. I was in Maine last summer up in Caribou, and I met a Vietnam veteran who had never engaged with the VA. And we were at a claims clinic out in the local community having a Maine breakfast, and he connected with a DAV officer and filed his claim for the first time because he kept hearing that VA wants to serve you. So he came with one of his buddies, and it's encouraging more veterans to come out. One of the main challenges we experience as we engage with the community is that there's a lack of understanding about what benefits are available. There's a lack of understanding about potential eligibility. And for many veterans, there's a lack of trust that we have to work to overcome.
And I think that point is so important. I can't tell you the number of veterans I encounter who say, oh, well, I don't think I'm going to go to the VA. But then once they actually go to our West Haven facility and they get some care there, they are amazed and they go back again and again. And I think that's really an important feature. It happened during COVID as well, when veterans went for tests or other kinds of care. The more we can draw veterans into those VA facilities, I can tell you the quality of care in the VA in West Haven and Newington is absolutely excellent. And I'm proud of the fact that this program has in part succeeded in getting more involved. And I'll just make this last point. It's going to the respiratory issue. It's not like we had a track record here that we could predict, oh, there are going to be X number of veterans with respiratory conditions. There'll be X number with hypertension. There'll be X number with pancreatic cancer or whatever. So we were working in uncharted territory. Senator Moran's point about timely reporting is in no way contradicted by this point, but it is one that I'd like to emphasize. And with that, let me turn to Senator King.
Thank you. I'd like to point out that Mr. Jacobs was in Maine at my invitation to meet with LL Bean to talk about how to deliver quality service. And we had a long meeting with the officials at LL Bean who are sort of the gold standard for customer service. And then he gained a lot of street cred in Maine by driving to Caribou. Freeport, Maine is about halfway between Caribou and New York City. We're a very tall state. So I want to thank him for that visit, and it was
when you said driving caribou, I thought you meant he was driving a herd of caribou.
Driving the caribou, no. I apologize for being late. If the VA IT system can figure out how to schedule Senate hearings so we don't have 3 at the same time, I'd appreciate that. And I don't want to replow a lot of ground. I gather that this shortfall is a result of greater than expected take-up of PACT Act benefits. Is that correct?
Yes, sir, in large part, both compensation and pension, as well as higher utilization and growth in the education area.
So, in a sense, and I know Senator Sullivan would disagree, but this is a result of success, which is good outreach and good invitation to veterans to take advantage of a new program. Is that correct?
I believe so. It's been historic levels of outreach and historic levels of benefits delivery by the more than 34,000 VBA employees.
Which created a greater demand on the budget than was anticipated when the budget was adopted a year ago.
Yes, Senator.
Okay, that's the good news. The bad news is, when did you know that this was coming, and when did you let us know?
We identified the potential need for an additional approximately $3 billion in mandatory funds in around June when we went through the mid-session review. At that time, we were comparing our projections versus the actuals, and we updated the claims model, which identified the potential need for additional funds. We, at the beginning of the year, estimated we were going to complete about 2.2 million claims decisions, which was 200,000 more than the previous year, which is an all-time record. What we found out in June was we anticipated, based on those new projections, to complete about 2.5 million, and we're on track to do that by the end of the month. And
So that extra 300,000 claims generated the additional demand for the funds, correct?
in large part, it's also the growth in the total number and complexity of the CMP exams and some of the additional growth in the education space.
So you knew in June you had a problem. When did we know?
I believe it was July. And what happened in the intervening days is we had to work to verify that our projections were sound, that we weren't ringing the bell unnecessarily, and that we had confidence that if we were going to raise this issue, it would be based on sound analysis. And so once we had done that, we communicated the request. But as we discussed, looking back, I should have picked up the phone and said, hey, we're working through this, and wanted to give you a heads up. So that's one of my lessons that I'm going to take from this and promise to do better.
Thank you. Thank you, Mr. Chairman.
Thank you. Thank you. He surprised me with his voice. He's not the chairman, but I'm glad to see you sitting there, Jerry. Thank you, Senator. So following up on Senator King's question, and I gather a similar line of questioning, and appreciate the opportunity, Senator Moran and the chairman for having this hearing. I want to, like Senator King, I don't want to plow old ground, so I'm just going to add on to his and jump over Secretary Elnahal to the Red Team report and the issue of community care, because it seems to me that at a time when demand is higher than you can provide for, that and that the Mission Act provided for more community care, easier access to community care. Seems like a mandate for better access to community care in big rectangular states in the middle of the North American continent, like Senator Moran and I represent, where there's a lot of distance between veterans. A lot of critical access hospitals which provide excellent service, and in fact, if they had a little larger, patient load, might even save some critical access hospitals. That the VHA seems to be very resistant still to access to community care. In fact, I'm going to go to the report and just highlight a couple of things in the Red Team report. Page 10, it states that the top 3 reasons for a veteran seeking care in a community are: 1, drive time. 50% say drive time. 30% say the services that they need aren't available. And then 5% say wait time. So the top 3 are drive time, availability of services, and wait time. And to me, that paints a pretty clear picture of evidence that there are not enough VA providers or facilities to treat veterans where they live, or to deliver the type of specialized care that they need. So to me, the reports like this highlight more of a commitment to the bureaucratic institution than to the access to care by the veteran. Can you explain why there's been such a resistance by the VA to allowing more community care easier?
Well, Senator, I agree with you that the community care network is absolutely essential to provide timely access to care, especially for rural veterans and especially for specific categories of care like long-term care. And over the last several years, we've grown at very high rates in the community care account. This year so far, we're up 14.5% on community care referrals compared to last year. Part of our request for supplemental funding is to support what the current budget projects, which is only 12% growth. We think we need to grow by another 16.5%. And what I've emphasized to all of our medical centers is that when a veteran qualifies for community care under the Mission Act, it is our obligation to offer that option. We also have to offer VA options, in my view, and put the veteran in the driver's seat to make the final decision when veterans qualify for both.
So you just used the term, when a veteran qualifies.
Yes.
And that's one of the things that concerns me a little bit, because the bureaucracy of all types, that's one of the ways they can manipulate is by not qualifying them. And the benefit of the doubt, in my mind, it's always frustrated me that the default or the benefit of the doubt never goes to the veteran, say in a challenged situation. So I think what I hear you saying is if the committee and if the Congress provides you better resources, perhaps the first thing we could look for are services that already exist in a lot of these communities and make it easier for the veteran to get that care there rather than build a bigger VA bureaucracy, because it should be about access to care, period, across the board, veterans and non-veterans. And I think that the dynamism of that patient load and the capacity of a lot of community access hospitals and other things, it could be winners all the way around. So my pitch is that please let's look first at existing capacity and infrastructure before we build out a bigger bureaucracy.
We have to make the right decision, Senator, for every veteran, and if that right decision means a community care provider that's closer, more convenient for them, and can get them that care quicker, we have to elect to do that. And the veteran, in my view, has to be in the driver's seat for those decisions.
I totally agree, and I can hardly wait to tell all my veterans that's going to be the new world order. Thank you.
Senator Kramer, thank you. And I smiled at Dr. Elnahal because he and I have this conversation on such a frequent basis. And I, again, would remind, based upon what you said, and I would remind veterans and the VA that one of the categories by which you qualify for community care is when it's in the best medical interest of the veteran, determined not by the VA, but determined by the veteran and his or her healthcare provider. And so when you talk about the bureaucracy, I mean, a determination of best medical care, best medical interest is something that is certainly available to a veteran and certainly ought to be recognized by the VA. That is not the topic of the hearing. And I leaned over to Senator Blumenthal because he said something that I was going to follow up on. We have, in many instances, used this hearing as an opportunity to commend and congratulate the success of the PACT Act. And I certainly don't have any reason not to do that. In fact, I have every reason to commend and congratulate the success by you and the people you call that are within the VA who are so qualified and capable of bringing veterans into the benefits of the PACT Act. So that is, but my point is that is not necessarily the purpose of this hearing. It's fine. But I don't want us to get off track because I still believe that process matters, and a success is a great thing, but we have our work to do in regard to how we fund so we can continue to have success in the PACT Act. I want to ask just a couple of more questions and make sure that I'm not missing something in the answers that you gave me. One of the things that I don't know which one of you said, but it was something like we chose not to meet the targets. Was that you, Mr. Jacobs? Chose not, when talking about the targets within the PACT Act, we knew we were going to exceed those targets, but we decided to proceed anyway. Am I saying something that you said, or Dr. Elnahal?
Are you referring to the phased implementation of the PACT
Yes,
Act?
I am.
Yes, sir.
This is not a criticism.
Yeah.
I'm not trying to trick you in any way. It's not a criticism.
Yep.
But that's the kind of thing that suggests to me that when you're making that decision, it's a point in time in which it would have been useful to notify Congress. Hey, we're there, we're doing well, and yes, I mean, we intentionally. One of my concerns about the PACT Act when we originated this effort was the ability of the VA to meet the needs of veterans when so many veterans were already in line waiting for benefits and services. And we put those provisions in there.
Yeah.
And I would not be one who spends time saying we should slow things down. If a veteran needs care, I want the VA to provide that care. So not a criticism, just a suggestion that that's a reminder about you knew something was happening.
Yeah.
And I don't want to keep beating this, but that was a suggestion that you be picking up the phone or sending a letter or testifying in a hearing that we're moving forward faster than what the PACT Act anticipated.
Senator, I believe we made that announcement at the time of the law's enactment, and it was based on an analysis that we concluded. We identified we had the authority to accelerate. And in fact, since the law's implementation, we've had more than about 340,000 veterans who now are getting PACT benefits that would not have been eligible, 60,000 of whom have cancer. And as we made that analysis, it was not only about delivering these earned benefits more quickly, but it was also the potential inefficiencies that we would have experienced by some of the processing challenges. So we thought that this was in the best interest of the veteran and also more operationally focused and
my only point then, Mr. Jacobs, would be that you made that decision at the time of the enactment, the signing into law of the PACT Act, and then didn't tell us that what you were, how that was proceeding, and yet you waited till you crossed the T's and dotted the I's on the estimates before telling us in the day after the hearing. I've made my point. I'm just trying to point out that I've made my point. Let me ask this. I want to make certain that I understand. While I've been complaining that we didn't receive notice, and perhaps that sounds personal that I didn't receive notice, to my knowledge, neither did the chairman or the ranking member and chairman in the House or the Appropriations Committee. But let me ask that question. Did anybody within the administration, the VA, or OMB notify anyone in Congress, the leadership of the Senate or House? Am I missing something? I want to make sure that I'm complaining about this committee not being notified or the Appropriations Committee that I serve on not being notified, but maybe somebody was. And do you know anybody that would be?
On the healthcare side, Senator, we have been tracking budget execution very closely, and just on our side, we did make the decision, in full disclosure, to accelerate healthcare eligibility on March 5th to many cohorts of veterans that would have otherwise qualified every 2 years leading up to 2032. And so we made that decision. Right after that decision, the Secretary testified in the budget hearings. He did mention that the budget was tight on the healthcare side, and that we would be monitoring it very closely leading into the summer, and if we ultimately needed more funding to support all the additional vets and the upgraded vets on their priority groups, that we would come to Congress. So what I can tell you is that when we identified that need, and we knew in order to maintain the outcomes and not see access get worse, veteran trust get worse, as of July, we knew we needed to actually grow our workforce, and we knew we needed to support more community care. We came forward. But that's always a month-by-month assessment that we make. I'm talking about the notification to all 4 committees in July that we made out of the healthcare system.
And was anybody in Congress notified before the July notice to the committees that you just mentioned, the 4?
Not to my knowledge, Senator.
No one indicated this to Senator Schumer or to Chairman Murray?
Not to my knowledge.
And would you...
No,
Mr. Jacobs.
not to my knowledge, but what I'd be happy to do is go back and confirm, just to make sure. I don't have all the dates, and I just want to make sure we give you an accurate answer.
And then, thank you very much. And then the same or similar question, was there conversations within the VA, the administration, or OMB about not notifying Congress? Did anybody make that suggestion or request to the VA? And are you aware of any conversation that took place that was suggested by OMB or other administration officials to the VA, let's delay notifying Congress?
No, Senator, the Secretary was very clear that once we had an understanding that this was a real concern, that we had an imperative to notify as quickly as we could. He made that very clear.
I suppose that perhaps there's an interest in why this question, the answers to these questions matter to me. I would assume that notifying us the day after we mark up our Milcon VA bill, perhaps that's evident. It would have been useful information for the Committee in Appropriations. But I also worry about this debate that we have in an ongoing annual basis about what's considered domestic spending and what's considered defense spending. And what was decided without that information, or if someone had the information and others didn't, it was not a fair conclusion about how to divide. This is in broad terms, Democrats want to spend more money on domestic issues, and Republicans want to spend more money on defense. I further admit that there's a lot of confusion now in this kind of definition. There's no clear cut to what I'm saying. But when we make the decision about what's defense and what is domestic, veteran spending is always something that can be one or the other. And I'm trying to find out whether someone is playing a game with Congress to make a different outcome than the one that we made.
I know, Senator, that in the president's budget, we've requested for multiple years having actually a third budget category for VA medical care so that it wouldn't necessarily be entering the debates on the non-defense discretionary side. And so I know that Congress has considered that before. We still think it's a good idea so that, you know, veteran medical care funding isn't taking away from other really important agencies that serve the American people. I still think that's a good idea so that we don't allow for some of these other debates to interfere with what veterans need. And so I just wanted to make that point.
But neither one of you or anybody that you've talked to is aware of that conversation taking place with direction or suggestion as here how we can tip the scales one way or the other in regard to what decision the leadership of Congress, the leadership of the Senate and House is going to make.
No, again, not to my knowledge, Senator, and we are requesting VHA's supplemental funding in the form of the Toxic Exposure Fund because we believe that all of that funding will be needed to serve veterans with exposure to toxic substances. That's a very important requirement for the TEF account, and we believe all of it would be used for veterans with toxic exposure.
Thank you. Mr. Jacobs, anything?
No, sir.
That you have the same answer that
Sa-
you're
yeah,
not aware
correct.
of?
Not aware of anything, yeah.
Thank you. Senator King, I'm told you're going to close out the hearing. I don't know whether I'm supposed to yield to you.
That's always a good thing to do.
I'll yield to you.
I appreciate it. I appreciate your questions. First, I want to associate myself with the question that Senator Kramer was asking, although I want to disassociate myself from the word bureaucracy. The people that I know that work in the C-Box and the Veterans Hospital at Togus, I don't consider, if there's any pejorative tone to the word bureaucracy, they're not it. They're dedicated to the veterans of Maine. And so I just wanted to be sure I mentioned that. I want to thank you all for being here today. This is an important conversation, and I hope that the Senate will join me in acting quickly to ensure that we deliver these resources, hopefully within the next 24 hours, to avoid negative impacts as well as the anxiety that's out there today on the veterans, our veterans and their beneficiaries. We'll keep the record open for a week.
Mr. Chairman?
Yes.
May I add one comment?
Please.
It will be in agreement with you.
Always.
I too, Senator King, have asked my colleagues, Republicans and Democrats, to be supportive of reaching a conclusion today or tomorrow in regard to the additional funding necessary.
Thank you.
And I want to make certain that that happens, and my expectation is it will happen tomorrow.
Thank you. This hearing is adjourned. Thank you.